Thank you. Thank you. I'm glad to be with you and talk about sort of what's going on with us and sort of what's on my mind. And the top of it is all every day, every morning is our network, right? And the frailty of the network that we rely on to serve at CareOregon over 500,000 people, right? And so that's not the system writ large. Even for our tiny bit of it, the challenges are immense. And as creative as we want to be in programs and setting up ways to engage people and get them to a healthier state personally and in their communities, if we don't have the partners who can make that happen, then we're lost. And I think there are a lot of needs out there right now. So the workforce, the ability and availability that gives them access, whether it's hospitals or dental hygienists or psychiatrists or SUD vendors, transportation across the board, it's really a burden for our members, and one that just makes life so much more difficult than it needs to be for them. It's still the primary issue, but in the past we were blessed with federally qualified health centers, right? Academic medical centers, people who are just passionate about serving the underserved, that we were able to have providers who would take those lower payments and serve Medicaid members. What's happened now with the overall contracting and shrinking of networks and available providers, those that are left have to take care of themselves. And that means getting the higher revenues from commercial plans, or even less than that, but more than Medicaid, Medicare, and then finally Medicaid, because they have to keep their doors open as well. So I think it's really constricted the availability of folks who can take Medicaid patients as a part of their panel. That's substantial. They just don't have the manpower, the willpower, the bodies to be able to serve everyone that comes in, and so they have to prioritize. And I think that's where it's exacerbated the problem, I believe. Oregon, we've just started the process, April 1st, actually, of redetermining people. And I think Oregon has been very deliberate about the need to be smart about this, because even in Oregon, we're looking at all 1.5 million people needing to be redetermined and impacted over the next, obviously, 14 months. Of those, estimates are that around 17 to 20% of those individuals may fall off of the rolls at some point. That's a big number. That's a lot of people that will be impacted. Some will roll over onto the exchange plans. Others, because we've been working, I was on a task force actually with the state to create a bridge plan that will allow people between 138% of FPL and 200% of the poverty level who are currently on Medicaid to actually stay on Medicaid and not move the exchange, and expanded program. And then we'll eventually bring that entire population of 138 to 200 onto a part of the Medicaid CCO program. We've got coordinated care organization programs. And so we're definitely protecting those folks that are churning the most, to keep them from even having to deal with the exchange at this point while we stabilize things. For CareOregon, in the first 2 months of 2023, we've handled over almost 3,000 calls from members specifically asking about what's going on with redetermination. It's on the top of mind. And so what we're doing right now is supporting the state any way we can. The managed care companies have the ability now to gather updated addresses and send those onto the state, which is huge. So that's one of our main efforts right now, is making sure that we have the right contact information, so when members do need to get redetermination, they actually get their forms, they understand how to fill them out, and then we can work with them and community benefit organizations to say, here's how you get into the state, here's how you fill things out, let's keep it top of mind. So our efforts are really about making people aware of what's going on, getting updated contact information, and then working with our communities to get them into the system so they can keep their coverage. Yeah, the deal with SCAN that we don't even necessarily refer to as a merger, we call it a combination, because I think different than traditional mergers where you'll have two companies who are disparate and doing their own thing that then are put together to create something brand new. That's not what we're doing here. We're working with SCAN to create an umbrella organization of sorts, right? A parent company called HealthRight Group, of which CareOregon will be a subsidiary, and the SCAN health plans will be subsidiaries, and we'll have a shared services division. We'll have an ancillary services division, but CareOregon will continue to exist with our name and our mission and our board, our relationships in our communities as we've always had, just as a part of a larger organization. The entire conversation actually happened almost by accident, in that they had new leadership starting at SCAN right at the onset of COVID. Of course, Sachin got the tough time to start, but one of the current SCAN board members was a former board member of CareOregon who was on our board when I was hired. And when they brought Sachin in at SCAN, she knew that they were looking at being more aggressive and thinking about regional strategies. And she connected Sachin and I to talk about just what we had in common and share stories and best practices, because we had similar missions at our companies. And so this wasn't a financial transaction. This wasn't something that bankers brought across, and neither said, hey, you want to be a partner? It truly was a mission-based conversation about how we go about the business, the challenges we faced. And as we talked more and more, we realized that there was true alignment in complementary businesses. We don't overlap in services and geography. We're primarily Medicaid. They're primarily Medicare. They're in California now, Texas, Arizona, New Mexico, or not New Mexico, Nevada. I'm sorry. We're in Oregon, and so there's no competition here. It truly is about creating something that will let us do things we couldn't do before. We've had challenges even in Oregon, where we're a major player, in that all the other partners that we work with or compete with are part of larger regional organizations. They have greater wherewithal than we do to do the technology challenges that are coming forward, to do the analytics, staffing, and finding the right people. We're at a disadvantage, and there's a challenge and problematic ability for us to keep up with the Joneses, frankly. And so we think through this affiliation and combination with SCAN to create HealthRight Group, we'll then have the ability to have better technology, to contract together and talk to vendors differently, to have greater opportunities for our staffs to be more innovative in programs that we have that they want to implement, that they have that we want to implement. So I can ramble on about this because I'm excited about this combination, and we're going to do great things for people in Oregon and through the HealthRight Group outside of Oregon as well. CareOregon currently has Oregon's largest dual eligible Medicare Advantage population. So we've been in Medicare for 12 years now. We, until 3 years ago, had a straight MA product as well that we weren't particularly adept at, because our work in Medicare is directly tied to the work we do in Medicaid. I think with SCAN and their knowledge in HealthRight, we may reevaluate doing straight MA in Oregon again, because they've been a 4.5-star plan in Medicare for 6 years running. We're 3.5 stars, right? So that one extra star means a lot to members and the benefits that you can provide to them. And so those are the kind of things that will definitely come into play. We're more looking at doing things that are programs and projects that we otherwise wouldn't do. We may look at PACE programs, for example. We don't know that CareOregon in and of ourselves have the experience, but it fits in the continuum of care, and it's important to us. If the state moves towards LTSS, SCAN has a lot of experience working with LTSS. And so it's those kinds of things that really excite us in bringing additional capabilities to what we can do to provide greater access to care in Oregon. When I talk about the engagement and the growth in sort of particularly the IT space from the combination, it's less about either entity having sort of a market advantage over the other and how we do it now. It's about saying, we've looked at our claims payment system for a while, right? They have as well. It would be nice to look at what's sort of best and brightest, what's best in market now for those kinds of systems that will truly integrate all the care that we have, plus with our providers, and have sort of two-way communications, closed loop systems. Those kinds of system implementations are incredibly expensive. And as big as we are, we don't have a lot of leverage with the organizations that provide those products. But together, we have much greater scale and scope to engage providers, and we would be able to basically split the costs as we approach building sort of the system that we both know we need to move forward. And I think it's more about that than sort of migrating one system or another from what we've already got. It's about the ability to do something new and bigger together, leverage analytics, the actuaries, and being able to shift folks around, learning from them on how we put together value-based contracts, because they've got a lot of delegated agreements where we've got a lot of direct contracts, and then working with them to show them how we do direct care management, for those new populations they have where they're not delegated. So it's more of that kind of thing that we're talking about.